The difference between type 1 and type 2 I think is so important for people to know, because basically if you're going to reverse diabetes, you need to understand it. Now, type 1 diabetes is known as a type of diabetes that is inherited. And so young children often get it, and it's called juvenile diabetes. And it's actually an autoimmune disease, and what happens is your own body starts destroying the cells in the pancreas, and so the pancreas cannot make any insulin. So it is also known, type 1 is known as insulin dependent. People have to give themselves insulin if they're a type 1 diabetic. And the reason for giving yourself the insulin is because without insulin, sugar cannot get from the blood system into the cells of the body to produce energy. Now, type 2 diabetes is brought on through lifestyle changes. So anybody can get type 2 diabetes. You're not born with it. It just usually happens over the course of time because you're not eating a proper diet and you're not exercising. Type 2 diabetics, usually it shows up about when the age of 45. Unfortunately, we're now finding children as young as 11 and 12 getting it because of the poor diets. What happens with type 2 diabetes is that you destroy your insulin sensitivity. And as I said, insulin needs to be in your body and needs to be working so you can get the sugar from your food into your bloodstream and into the cells. So if you don't have insulin working and you're not insulin sensitive, you don't have any energy. And the name for that is insulin sensitivity. And what happens is, by eating a lot of processed food, by not exercising, by eating a lot of fried foods, by just not taking care of your body, you destroy its ability to produce insulin, and you no longer have insulin. That is why doctors then will start giving you insulin, because the sugar stays in your blood vessels. It does not go into your cells, and it does a lot of damage. And what you find is people, the worst thing about type 2 diabetes is you find people, their chances of getting cancer are higher, their chances of having a stroke are higher, their chances of having kidney disease are higher, their chances of almost any disease become higher, even Alzheimer's. Their chance is 65% higher if you have type 2 diabetes. And the worst of it is, the people that I've interviewed that have had type 2 diabetes is the amputations. That is really sad.